By request, number 6, radio counseling, coping skills for PTSD, or shell shock, or combat fatigue, or post-traumatic stress disorder. It has a lot of names. And frankly, it has as many sources as there are stories. See, every story has a beginning, a middle, and an end. There's always a plot, a setting, a motivation, and a complication. Now, the complication is where our hero, it's you, encounters some sort of obstacle, some profound difficulty. Frankly, Hollywood loves to do some horrible shit to the hero. In the next scene, they're wandering around, pounding bad guys to a pulp. The reality is there are profound consequences to profound events, especially when violence is involved. So the symptoms of PTSD are remarkably varied as well. There's a ton of studies done on why some people get into similar situations and some of them develop serious clinical symptoms and the others just don't. They move on with their life. If you're wondering if you have actual PTSD at a kind of a clinical level, this is a really simple test. Are you suffering from recurring and intrusive thoughts that on a daily level cause you concern? If yes, then yes. If no, then you might have just kind of a problem. See, now our bodies are great at healing. When we get a scar, we can watch it disappear over a few days. But take that same scar and imagine instead of healing, it just kind of closes up. It gets under your skin, festers, becomes infected, and it just kind of grows. It itches, then it hurts, and eventually you're going just mad trying to get it to stop hurting. Our brains aren't really that different. See, our neurology tries to heal up everything, essentially make it a calm memory. But like that scar, that memory, if it's not integrating properly, can cause you pain and suffering. So the bad news is the trauma isn't going to go away. It's in the past, and we lack the time machine technology to go back and fix it. The good news is that there are so many, many ways that we can deal with it. Now, my favorite is called EMDR, eye movement desensitization and reprocessing. It bears a lot of similarities to hypnotism, but allows for your brain essentially to, under guidance, reshuffle your cognition and sort of reprocess that event into a semblance of normal order. So instead of there being this glaring anomaly in your memories, you have another thing that's happened. It's kind of like breakfast. You remember what happened at breakfast. Hopefully it was a calm, ordinary thing. You ate it and then you moved on with your day. But the EMDR would allow you to reprocess the memory, so it becomes just that, sort of foregoing the pain in exchange for reprocessing it into normal. There's also a ton of other therapies. I mean, trauma is literally the genesis of counseling. Nobody's ever gone to a counselor. Everything's great, man. No problem. So if something's interfering that level with your life, just go see a counselor. It doesn't have to be that way. And with individual events and isolated traumas, it's not minimizing to say the pain can go away within a month, 2 months, and just done. That's without medication or anything else. So go take care of yourself. Go, 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 go. If you don't do anything, nothing's going to change.